Before we even submitted our proposal, we were asked why by WASH and humanitarian colleagues alike. Why focus on menstrual health in a disaster, they asked. It's not a life-saving need. And why only people with intellectual disabilities? Perhaps these are questions that you're asking yourself. Vanuatu is one of the most vulnerable countries to climate change and natural disasters, which are increasing in frequency and severity. You may have heard the slogan, periods don't stop in pandemics. Well, they don't stop in disasters either. Our research has shown that menstrual health for people with disabilities may be one of the most neglected frontiers in the humanitarian sector. Whilst there is increasing recognition in the humanitarian sector to prioritise the menstrual health and hygiene needs, these interventions are often tailored to the requirements of people without disabilities. The unique menstrual health and hygiene needs of women with disability have only just begun to be considered in humanitarian spaces and often relate to infrastructure. These limited considerations have not yet extended to women with intellectual disabilities who require more holistic, customised support. I'm Chloe Morrison, and I'm joined today by my colleague Relvie Poilapa. We both work for World Vision Vanuatu and are together leading a research pilot project that is seeking to both better understand the menstrual health experiences of young people with intellectual disabilities in emergencies, and also adapt and evaluate the feasibility of an intervention to better support this group and their carers in future responses.
So before we get started, allow me to provide some context. Vanuatu is a small Pacific island country that is frequently ranked the most vulnerable country in the world to natural disasters. People, especially in rural areas, experience poor access to WASH. With support from the ELRA Humanitarian Innovation Fund, World Vision, the London School of Hygiene and Tropical Medicine, and the Vanuatu Society for People with Disabilities, we conducted a formative research with people with intellectual disabilities and their carers to explore their menstrual health experiences, especially in times of disaster.
So whilst the project is based in Vanuatu, and we had wanted to also test it in another setting, but COVID had different ideas, we wanted to also better understand what global evidence exists on the topic and conducted a systemised review which aimed to identify and map the scope of available evidence on the inclusion of people with disability in menstrual health, and also to understand its focus in comparison to menstrual health for people without disabilities in emergencies. 51 papers were included, but only 26, so just under half, mentioned menstrual health and disability in humanitarian settings. The discussion in these instances was fleeting and incredibly light, and often mentioned that we needed to do more research in this space. Women and girls rarely participated in menstrual health efforts. They experienced reduced social support and were less able to access WASH facilities, including disposal facilities. Hygiene kits provided were not always suitable or appropriate for people with disabilities. And our research demonstrated that caregivers across all genders require, but lack, guidance about how to support an individual with disabilities to manage menstruation.
So in the aftermath of a Category 5 tropical cyclone Harold, and also with households that had been impacted by the Ambai Island volcano evacuation, we conducted formative research with 17 carers and people aged between 15 and 30 years who had intellectual disabilities to investigate the barriers to MHH that they faced during those emergencies. The research included tools such as photo voice, and also we used participatory observation methods involving a large doll with the young people with intellectual impairments. As you can see, the results were stark. Carers and young people themselves had received little to no information to manage menstruation, and almost half of all the caregivers keep the young person at home when menstruating because of the fear of ridicule that that person may have faced, and blood that may have stained her clothes, or the risk of gender-based violence.
So what does this have to do with emergencies? Well, as mentioned, many households reported keeping young people at home when menstruating. The stigma around menstruating and also the disability itself meant that many did not seek safe shelter during the disaster. And as this participant, who was a participant in Photo Voice, a carer, explains, even for those who did evacuate and seek safety during the disaster and in the aftermath, they faced a lot of challenges in managing menstruation, particularly because of the lack of privacy. So as this carer says, we had gone to live with her uncle during and after the cyclone. In the house, there is no privacy. Therefore, when she's dirty, which was in reference to when she menstruates, I had to take her out of that place, away from other people, and come here where we feel that there is privacy. I would fetch a bucket of water and put it behind a tree where no one can see her when she's having her shower. Well, actually, at that time, there was hardly any trees standing, but I had to find somewhere she could shower so no one could see her, which also highlights the impact of poor access to wash after a disaster and how it impacts people with disability, perhaps in different ways to those without. And this experience was really common throughout our research, where households reported if they were staying with family in the aftermath, that they would go back to their land, even if their house had been totally destroyed, even if there was nothing there, so that they had privacy, especially when the young person was menstruating, just for fear of others seeing her or her taking off the pad in public, etc.
So throughout the formative research with both carers and key implementing partners, a number of recommendations were given regarding the hygiene kit contents. Hygiene kits were welcomed. However, too often a one-size-fits-all approach was taken, especially in relation to sanitary products. So key recommendations included the need to include a lot more menstrual materials because it was often difficult to afford, and or because it was difficult to dry reusable products quickly soon after, especially if it had been raining, and especially after a cyclone. Having the right material can mean carers are more comfortable with the person with the disability and also more comfortable going out when they were menstruating, especially important for households that were displaced.
So along with equipping households with kit contents, there's also room to improve behaviour change and understanding of menstruation, which can also improve the effectiveness of current interventions, including something as simple as hygiene kit distributions, as well as the preparedness for families, which can support them to seek safety during a disaster. So the Veivanua campaign is based on two characters that you can see on screen: Veivanua, a young person with intellectual disability, and her carer. And it's based off the Bechester campaign, which was developed and piloted by Jane Wilbur in partnership with London School of Hygiene and Tropical Medicine and WaterAid in a development setting in Nepal. It uses a behaviour-centred design approach to develop the intervention and aims to create positive behaviour change in both the young person and also the carer.
So currently in country, we're conducting a campaign in a recovery setting, but in Vanuatu, communities are often on the edge of the next disaster or event. And so it's also serving as a preparedness tool. We have developed campaign components to help people build MHM skills and communication to adopt target behaviors. Training sessions support carers and the young people with the knowledge and tools to achieve 5 key target behaviors that focus around the effective menstrual product use and the disposal, as well as support for when the young person is menstruating. We have also received interest and will train other agencies and actors on the approach and will pre-position kits for future disasters.
So the training aims to be participatory and includes tools that were developed especially for people with intellectual impairments, such as the doll, the Veivanua doll that's on screen there, and that enable changes in understanding to be captured through observation rather than traditional survey approaches that may not be suitable for all of our target group. For instance, we'll use the Veivanua doll with young people to practice changing and disposing of a menstrual material. We also provide throughout the campaign a large menstrual storage bag, which you can see depicted in the illustration there, which aims to support carers to make sure they've got enough menstrual products on hand when the young person is menstruating, but is also something that can be very easily taken with the family should they need to evacuate quite quickly to help with preparedness. So that brings us to the end of our presentation today. There's a lot of information there and also a lot more available. So here are some links if you wish to find out more about our project, the systemised review, and also more general background information on menstrual health for people with disabilities in Vanuatu. Thank you very much for your time.